What if I told you that something sitting in your medicine cabinet right now, something you reach for without a second thought, might be quietly raising your risk of a heart attack or a stroke? Not a street drug, not something exotic, something with a friendly name and a familiar box. Today we are going through 5 categories of common medications that carry real documented cardiovascular risk for adults over 60, why that risk exists, and exactly what you can do about it without panicking or stopping anything on your own. Before we go further, a quick but important line. This video is for education, not diagnosis. Every medication decision belongs between you and your own doctor or pharmacist, who knows your full history. Nothing here should replace that conversation. Now let's get into it. Here is something most people do not realize about getting older. Your cardiovascular system does not fail like a light switch flipping off. It wears down slowly, like a garden hose that has been left in the sun for 20 summers. It still looks fine on the outside, but the rubber has gotten stiffer. The pressure inside it behaves differently than it used to. And that means the same hose that handled a strong blast of water just fine in your 30s can spring a leak under a pressure that would have been nothing 20 years earlier. Your blood vessels are that hose. After 60, the walls of your arteries naturally stiffen, your kidneys filter a little less efficiently, and your body's margin for error shrinks. That does not mean you are fragile. It means a medication that was perfectly harmless at 35 can behave differently inside a 65-year-old body. Same pill, same dose, different plumbing. Stick around, because the 5th one on this list is not the one most people expect, and it involves a mistake nearly all of us make without ever realizing it. Let's start with the most common one, something so ordinary that almost nobody thinks of it as a heart risk at all. Number 5 on our list is the everyday pain reliever family known as NSAIDs. That stands for non-steroidal anti-inflammatory drugs, and the easiest way to think of them is as the over-the-counter pills people reach for when a knee aches or a back stiffens up. The thing is, these medications do not just calm inflammation. They also affect how your kidneys handle salt and fluid, which can push your blood pressure up like a thumb pressing down on a garden hose nozzle. They also change how easily your blood clots. Think about what that means together. Higher pressure in the pipes, stickier traffic moving through them. That combination is exactly the kind of thing that can tip a stable artery into trouble. The Food and Drug Administration has required a warning on these medications stating that cardiovascular risk can increase after just a few weeks of regular use. Harvard Health has reported on a growing body of research linking regular NSAID use to higher rates of heart attack, stroke, heart failure, and irregular heart rhythms. And a large nationwide study out of Denmark, following nearly 98,000 heart attack survivors, found that regular use of these medications was associated with a 42% higher risk of cardiovascular death compared to people who were not using them. Here is the part that should actually make you feel better instead of worse. This risk is heavily tied to dose and duration. Short-term, occasional use for an acute ache carries far less risk than daily long-term use. So the actionable step here is simple. Use the lowest dose for the shortest time that actually controls your pain, and if you find yourself reaching for these pills almost every day, that is the signal to call your doctor, not to push through quietly. Number 4 is one almost nobody connects to the heart at all. Cold and sinus decongestants. You feel stuffed up, you grab the box with the red letters, and you do not think twice. But the active ingredients in most decongestants, things like pseudoephedrine and phenylephrine, work by tightening blood vessels. That is literally the mechanism. It shrinks the swollen vessels in your nose so you can breathe. But your nose is not the only place with blood vessels. The same tightening effect reaches blood vessels throughout your entire body, including the ones feeding your heart and brain. Picture squeezing a hose at the same time water is already running hard through it. Something has to give somewhere. The American Heart Association has specifically flagged decongestants as a concern for people with existing heart conditions, noting they can raise blood pressure and add strain at exactly the moment your body is already fighting off a cold or flu. Doctors interviewed by major health outlets have pointed out that older adults are especially vulnerable here, partly because so many of you are already taking blood pressure medication, blood thinners, or diuretics, and stacking a vessel-tightening decongestant on top of those can destabilize blood pressure control that took months to get right. The practical fix is not complicated. Choose nasal saline rinses or antihistamines first when you are congested, especially if you already have high blood pressure or heart disease. If you do need a decongestant, the shortest possible course is the goal, and it is worth a quick check with your pharmacist rather than guessing in the cold and flu aisle. This is a good moment to pause for something practical, because what comes next builds directly on what we just covered, and it explains why some people end up in real trouble even when each individual pill seemed harmless on its own. If a video like this is useful to you, subscribing genuinely helps a small channel like this reach more people who need to hear it. And I read every comment, so tell me which of these 5 surprised you most. Now back to the list, because we are just getting to the ones that worry me more. Number 3 is a category that people often take for a few weeks and forget about entirely. Oral corticosteroids, the most common one being prednisone. These are prescribed for everything from a bad asthma flare to arthritis pain to an autoimmune condition acting up. They work by powerfully calming down inflammation throughout your whole body. The trouble is that the same chemical signal that calms inflammation also tells your body to hold on to sodium and fluid, which raises blood pressure, and it can affect your blood sugar and cholesterol at the same time. It is a little like turning down a smoke alarm by also turning up the furnace. You solved the immediate problem, but you created a new one in a different room of the house. A major population-based study tracking nearly 90,000 people found that even low doses of these steroids, under 5 milligrams a day, were associated with a 74% higher risk of cardiovascular disease compared to people not taking them. At higher doses, above 25 milligrams a day, that risk climbed to roughly 6 times higher. A separate study following patients with breathing conditions found the risk of a heart attack roughly doubled with current steroid use and tripled at higher doses. Here is the important nuance, because I do not want you afraid of every steroid prescription you have ever filled. Inhaled steroids, the kind used in most asthma inhalers, deliver a tiny fraction of the dose and carry far less of this risk. The concern here is specifically about oral steroids taken by mouth, especially at higher doses or for longer stretches than a short flare requires. If you are on one for more than a week or 2, that is worth a specific conversation with your prescribing doctor about the lowest effective dose and a plan to taper down rather than staying on it indefinitely. Margaret was 67 years old when her rheumatologist had her on 15 milligrams of prednisone daily for several months to control a flare of polymyalgia rheumatica, the kind of joint and muscle inflammation that can make simply getting out of bed feel like wading through wet cement. Her blood pressure, which had been a stable 124/78 for years, crept up to 148/92. Her blood sugar, never a problem before, started showing up borderline high on her routine labs. Her doctor did not panic and did not simply yank the medication because doing that abruptly can be dangerous too. Instead, they built a careful taper plan, added a small dose of a blood pressure medication during the higher dose window, and shifted her pain management to include physical therapy and a different anti-inflammatory approach once the flare settled. 8 months later, off the steroid entirely, her blood pressure had returned to 122/76, and her blood sugar normalized completely. Nothing dramatic happened. No crisis. Just a doctor and a patient working the plan together with eyes open instead of on autopilot. That is what this whole video is about. Not fear. Awareness paired with a plan. Number 2 is one that surprises a lot of people because it feels like the furthest thing from a heart medication. Prescription opioid pain relievers. These are prescribed after surgery for severe injuries or for chronic pain conditions that have not responded to other treatments. For a long time, doctors mainly worried about the well-known risks of these medications, dependency and overdose. But newer research has uncovered something else entirely, a direct cardiovascular signal that has nothing to do with addiction. A large study out of Yale, published in the Journal of Pain, found that people prescribed opioids developed cardiovascular disease at meaningfully higher rates than those who were not, with higher doses associated with higher risk. Separately, a post-hoc analysis of the ASPRI trial, which followed over 17,000 older adults with an average age of 75, found that opioid use was associated with a 67% higher risk of cardiovascular events, most notably heart failure requiring hospitalization. Researchers at the University of Southern California's Schaefer Center went even further, identifying that within this drug class, the specific opioid oxycodone carried a 2 to 3-fold greater cardiovascular risk compared to other opioids in the same family. Chronic pain affects somewhere between 60 and 75% of adults over 65. That is not a small population on the sidelines of this conversation. That is most of you. The actionable piece here is not to white-knuckle through pain that genuinely needs treatment. It is to ask your doctor directly whether a non-opioid option could work as well for your specific situation, and if an opioid truly is the right tool, to ask about the lowest effective dose and the shortest reasonable duration, the same way you would with the pain relievers we talked about earlier. And now we get to the one that ties everything else together. The one I think is genuinely the most important, because it is not really about a single pill at all. Number one is what happens when you combine 2 or more of these medications at the same time, something researchers call cardiovascular polypharmacy. Here is the mechanism, and it is simpler than it sounds. Each of the medications we have talked about today nudges your cardiovascular system in a risky direction through a slightly different door. One raises blood pressure through fluid retention. Another tightens blood vessels directly. Another affects clotting. When you take just one, your body usually has enough reserve capacity to absorb that nudge safely, the way one person leaning on a sturdy railing does not bring it down. But when 2 or 3 of these nudges land on your system in the same week, or even the same day, they do not just add up. They can compound. Researchers at the University of Southern California's Schaefer Center studied this directly in older adults and found that taking multiple medications with cardiovascular side effects together, things like an NSAID alongside an opioid or a decongestant alongside a steroid, doubled or even tripled the risk of heart attack, stroke, or death compared to using any single one of these medication types alone. Their researchers noted something that should genuinely change how you think about your medicine cabinet. Prescribing a heart protective medication like a statin does not cancel out the risk of other medications you might be combining with it. The math does not work that way. This is exactly why doctors emphasize what is called a medication reconciliation, simply sitting down once a year with your doctor or pharmacist and listing every single thing you take, prescription, over-the-counter, and supplements, all in one place at one time. Most people only show their doctor what was prescribed by that specific doctor. Almost nobody hands over the full list, including the sinus pills from the pharmacy aisle and the leftover pain pills from a dental procedure 2 years ago. That gap is where the real danger lives. The single most powerful thing you can do after watching this video is to write down every medication you take, including the over-the-counter ones, and bring that full list to your next appointment. Here is what I want you to take from everything we just covered. None of these 5 things are reasons to be afraid of medicine. Pain relief matters. Breathing matters. Comfort matters. What matters just as much is using the smallest dose for the shortest time that actually solves the problem, asking your doctor specifically about cardiovascular risk when one of these categories comes up, and never assuming that because something is sold without a prescription, it is automatically without consequence. Your body after 60 is not weaker. It is simply running with a smaller margin for error, the same way a well-loved car still runs beautifully but needs a more careful hand at the wheel than it did when it rolled off the lot. You decide what goes into your body. You decide which questions you ask at your next appointment. That decision, more than any single fact in this video, is what actually protects your heart over the next 20 years. If someone you love takes any of these medications regularly, a parent managing arthritis, a spouse who reaches for cold medicine every winter, a friend recovering from surgery, sending them this video might be one of the more caring things you do for them this week. And if you want to understand your heart health at a deeper level, subscribe, because next time we are talking about the blood pressure number, almost every doctor checks but almost no one explains properly, and it might matter more than the one you have been watching all along. Take care of yourself, and take care of the people you just thought of while watching this.